Hi, I'm Dr. Amber Belt with Sage Sirona, and today what I want to do is teach you a hands-on technique that you can use at home when you have a cold, when you have an ear infection, when you have a sinus infection, that's going to help you move through these infections and be more comfortable more quickly. What I'm going to teach you today is a technique to help move lymph. How I want to start is by telling you that you have a lot of lymph tissue in your neck. And of course, if you've ever been sick, you've probably experienced swollen lymph nodes. But we have big lymph chains in our head and neck area posteriorly, so in the back of your neck here, in the middle section of your neck, and also in the anterior neck here. Now, we also have lymph nodes in front of our ears also. So if you have an ear infection or just clogged up ears, you might want to go ahead and check those lymph nodes and include them in this little lymph massage that I'm going to teach you. Generally, what I find is that a lymph massage, a lymph drainage technique, is going to work a little bit better if you have a little oil on hand. So what I'm going to use, or my preferred oil to use when I do lymph massage, is coconut oil. And this is a refined coconut oil, so it's not going to have an over coconutty smell, which when you're sick, a coconutty smell may or may not agree with you. The other item I'm going to use is an essential oil. And you can use, there are lots of different types of essential oils that are good for helping drain that lymph tissue, but I've chosen cypress today because I like how it smells. It's a new arrival from my autonomy box that I got this month, and I wanted to try it. Now, I do want to say, if you're working with essential oils, you never want to put them on without a carrier oil. So what I'm going to do is I'm going to use about a tablespoon of coconut oil and 1 or 2 drops of this cypress oil. Applying these essential oils neat or without a carrier oil can lead to a chemical burn. And I've seen this many times over the years with patients. They underestimate the power of an essential oil. They put it directly on their skin and then they end up with a burn. Not good. Now what I'm going to do to actually perform the lymph drainage technique is get a little bit of that oil on my fingertips. And I'm going to start from the back up by my hairline. You can actually go into your hairline if you don't need a little oil, if you don't mind a little oil in your hair, because we do have lymph nodes, up into that area. So you can start there, and what you want to do is with a very light touch, you want to pull down. Okay, you can do that, repeat that a few times. You want to come to the middle and repeat that a few times, and then you want to come to the front and also repeat that. Now, if you can also, get these ones that are anterior or in front of your ears by coming and pulling down like this. The goal is to guide all of that lymph up here towards the thoracic duct of your lymph gland. It's a big point of drainage for your lymph. So you can even come with your posterior more around to the front, which is probably a little bit more efficient at getting that lymph to the thoracic duct. So when people do these lymph drainage techniques, they're helping move and shift that lymph. So what I see a lot is if someone's struggling to move through an infection, an acute infection, a lot of times moving that lymph can provide them with some relief from just feeling full up in their head. And it can also really shift their energy, which is kind of an interesting phenomenon that I've seen. So I hope this helps you. Make sure you save this and come back to it when you get sick if you want to try it. And remember that this is all educational and shouldn't substitute for medical advice. Bye now.